Hey, Dr. Lindsey and Wendy here. This is a brief video of us revising an Iranian man's facelift scars.
Yeah.
And this guy's a little younger than me, right? And he went over to Iran and said he had a friend that had become a plastic surgeon and wanted to do a facelift on him.
A facelift on an American.
Okay. And then so he did that, and he said the doctor injected a bunch of stuff into him when he was closing him up.
Yeah, he showed us a video.
And which we can't show you. Oh, he didn't give me permission to do that.
No.
And then he gets back here, and he starts to develop these keloids in his cheeks. And he came in looking like this. Now, I had to crop off his face to show this, but he's got a finger growing in front of one ear, and part of a finger growing in front of the other. And so we cut those off, and then undermined the skin, and then closed it in 2 layers. And took the stitches out at, I think, day 5, and he looked like this. And then at about a couple of months out, he looks like this. And scars, take a year to mature. But the big issue, if somebody has a history of keloids, how are you going to keep them from getting it again? And we crossed our fingers and waved the magical vitamin E over him and had him use it. And I think we've gotten beyond that.
Yeah.
And so, if you have a facial scar from plastic surgery or something else, we'd be happy to talk with you about it. And this is how we address scars. And the idea is to try to remove them and close the defect with as little tension as possible, and then be religious about scar care afterwards. If we can help you, please give us a call. Thanks.